Okay, so this is your lecture video over Chapter 9, Parenteral Medications. This section is really a lot more of the same stuff we have been doing. Okay. So our learning objectives. We are going to calculate dosage for parenteral medications in liquid form. We're going to interpret the directions on drug labels and package inserts for reconstituting medications supplied in powdered form. We're going to talk about labeling reconstituted multi-dose medication containers with the necessary information. We're going to choose the most appropriate diluent volume when reconstituting a multiple strength for medication. We're going to calculate doses of parenteral medications measured in units. Okay. So these medications can come in ampules like this, and there is a special device for taking the top off of these. They can be plastic or they can be glass. They also may be given in vials, in which case you need to inject a certain amount of air and then pull out the amount of medication. Sometimes they are single dose, other times they are not. Okay, now in the book, but not in the PowerPoints, they give you certain guidelines for generally administered subcutaneously or intramuscularly to test your calculations for reasonability. Okay, if you're giving an injection subcutaneously, for an infant, the dosage is usually less than 0.1 milliliters. For a child, it is usually less than 0.5 milliliters. For an adult, it is usually between 0.5 milliliters to 1 milliliter. And then if you're giving an intramuscular injection, for an infant, it is usually less than 1 milliliter. A child is less than 2 milliliters. An adult is less than 3 milliliters, but if it's given in the deltoid, it's less than 2. You can find this information in your book. Okay, so let's look at our first problem. Okay, and here we go. This is the first example from the PowerPoint. The prescriber ordered 3 milligrams of dopamine subcutaneously immediately. The strength is 10 milligrams per milliliter. How many milliliters would you administer to the patient? Okay, like I said, this is regular dimensional analysis. And what we have to do is talk about our strength. We want to end up with milliliters. So whenever I take the information that I'm given, where we're told the strength here, we're given both the milligrams and the milliliters. I'm going to make sure that the milliliters are on top. Okay, what I mean by that is if I normally wrote down this strength, I would write 10 milligrams per 1 milliliter. Since I'm trying to end up with milliliters, I'm going to put milliliters on the top. This relationship, this ratio, can be flipped. So I can write 1 milliliter per 10 milligrams. I am supposed to give 3 milligrams, and I want milligrams to cancel out, so I'm going to put the 3 milligrams up here. And that's over 1. Okay? Now if we multiply here, our milligrams cancel out, and we're stuck with milliliters, which is the unit we want. And so this equals, just doing the multiplying straight across, 3 times 1 is 3 milliliters. Over 10 times 1 is 10. So 3/10 you would give 0.3 milliliters of this drug. If you look on the next slide, you can see that that's exactly what they did. Okay, here's that relationship we had. We flipped it with a milliliter on the top. They multiplied on the left here. We multiplied on the right. It's exactly the same thing. You can see them doing the cross cancellation. And then they did the arithmetic, 3 divided by 10 to get 0.3.